Hip pain can sometimes be coming from the lower back, and this can make it quite frustrating for patients who might be trying to do different exercises or stretches or strengthening exercises, focusing specifically on the hip or putting heat or ice on that particular location, when in fact their pain might be coming from the lower back. Hi, my name is Eric Hammer, registered physiotherapist and owner of Home Comfort Physiotherapy. And today I'd like to talk a little bit about lower back referral to the hip. But before I continue, please hit that subscribe button below so you'll be notified about any new videos that I have here on my channel. So it's very, very common, right, for a patient who might be experiencing hip pain in sort of the buttock area or down the side of the leg uh, to actually be stemming from the lower back area. And so for a lot of patients that I see, they might be coming to me with lots of frustrations because they might have been going for a couple months of, trying all sorts of different interventions on the hip. That could be heat, ice, different stretches, etc. And in some cases, their pain might actually be referring from the lower back. And so all this effort in terms of trying to really, focus in on the hip, unfortunately, it doesn't actually provide any comfort when the problem is actually coming from the lower back. So the lower back, essentially it's made up of different vertebrae, and in between the vertebrae we have what's called discs, and coming out of the spine we have these nerve roots, they're called. So these nerve roots, what they do is they form peripheral nerves which run down the leg, and in some cases what can be taking place is either the peripheral nerve or the nerve root can be compressed because of different situations that might be going on in the back. And then as a result of this compression, we can get this sort of referral. It could be kind of down to the side, down into the buttock area. Sometimes this referral can travel further down the leg. It can lead to just a pain specifically in the area. Sometimes it can lead to this sensation of numbness or tingling. And so the real key though, and this is where it's going to be really important as a patient to seek out an individual who's able to really address the source of the problem and clear the lower back appropriately. And so what I mean by clear is to actually go through the different tests that are involved in order to make sure that the problem, that the pain isn't in fact coming from the lower back. Because unfortunately, if we're just treating the specific location of the pain, right, in the hip, and it's coming from compression of a nerve, it's coming from the lower back, we can do all sorts of different interventions on the hip. But unfortunately, if we don't address the fact that there's a compression on the nerve or there's a referral from the lower back, that hip pain is just going to remain. And so again, it's going to be important to go through different mobility movements in through the lower back to see if there's a pain referral. It's going to be important to look at things like myotomal strength. And myotomal strength basically refers to the idea that these nerve roots that we talked about, that they innervate different muscles down the leg. And so when there's compression or irritation of a nerve root, what we'll tend to see is a fatigable weakness with specific muscles. We're going to want to do some form of sensation testing. We're going to want to look at things like nerve tension tests. So these are tests in which we put specific nerves on a stretch that travel down the leg and see if it provokes pain, or to see if there is a restriction of some type with these different postures and positions. So again, a really thorough lower back assessment is going to be important, again, to make sure that the symptoms are not coming just from the hip area, right? To make sure that we're clearing out that the pain isn't coming from the back. Because again, we can do all sorts of different interventions, we can give all sorts of different exercises, but if the source of the problem isn't where the pain uh, excuse me, if the source of the problem is in the lower back and it's not necessarily where the localized pain where somebody might be feeling it. We can do all sorts of different interventions, and unfortunately, it's not going to get better until we address the source. If you have any questions or concerns, feel free to leave a comment below. And please check with a physiotherapist to make sure that this or any other information here is appropriate for you. Thanks again, and have a great day. Take care.